The Sociology of Homeless Populations and Psychiatric Wards, a Vital Intersection of Study. Introduction. In contemporary society, marginalized groups such as homeless populations and residents of psychiatric wards often remain on the peripheries of public consciousness. These groups, while diverse in their makeup and experiences, share an intersection of vulnerabilities that merit rigorous sociological investigation. Understanding their unique social dynamics is crucial for developing effective policies and interventions to improve their quality of life and overall societal well-being. The intersection of homelessness and mental health. Homelessness and mental health issues are often intertwined. Many individuals experiencing homelessness also suffer from mental health disorders, which can both precipitate and exacerbate their condition. Conversely, the stresses and traumas associated with homelessness can lead to or worsen psychiatric symptoms. Studies have shown that a significant portion of the homeless population has been diagnosed with mental health conditions such as schizophrenia, bipolar disorder, and depression. This interconnectedness forms a vicious cycle, as untreated mental health issues can make it challenging to secure stable housing, while the instability and insecurity of homelessness can further deteriorate mental health. Sociological perspectives on homeless populations. From a sociological perspective, the phenomenon of homelessness can be analyzed through various lenses. Structural factors such as economic inequality, lack of affordable housing, and systemic discrimination play critical roles. Additionally, individual factors like substance abuse and family breakdowns contribute to homelessness. Sociologists employ theories of social stratification, social exclusion, and intersectionality to dissect the complex web of causes and effects. The concept of social stratification helps us understand how hierarchical structures in society contribute to the marginalization of certain groups. Social exclusion theory examines how being excluded from mainstream society affects individuals' access to resources, opportunities, and social networks. The role of psychiatric wards. Psychiatric wards serve as critical sites for the treatment of individuals with severe mental health disorders. However, these institutions are not just medical facilities, they are also social environments with their own unique dynamics. The experiences of patients within psychiatric wards are shaped by interactions with healthcare professionals, the structure of the ward, and the broader societal stigma surrounding mental illness. Patients often face a dual stigma, one associated with their mental health condition and another related to being institutionalized. This double burden can impede their recovery and reintegration into society. Mass delusions and subsets of groups. An intriguing and concerning phenomenon observed in both homeless populations and psychiatric wards is the emergence of mass delusions within subsets of these groups. Mass delusions are false beliefs that are shared by a group of people, often resulting in collective behaviors based on these beliefs. In the context of homelessness, the isolation, lack of social support, and extreme stress can create an environment where delusions take root and spread. For example, there have been documented cases where groups of homeless individuals share beliefs in conspiracies about government surveillance or hidden dangers in shelters, leading them to avoid potentially life-saving services. In psychiatric wards, mass delusions can be exacerbated by the close quarters and intense interactions among patients. For instance, a patient with paranoid delusions may influence others to adopt similar beliefs, creating a feedback loop that reinforces the delusional thinking. This phenomenon is particularly pronounced in wards with inadequate staffing or where patients have limited opportunities for individual therapy. The social dynamics of psychiatric wards, including the power imbalances between patients and staff, can further complicate efforts to address these delusions. The importance of studying these groups. Studying homeless populations and psychiatric wards is essential for several reasons. Policy development. Informed policies based on empirical research can address the root causes of homelessness and improve the treatment and rehabilitation of individuals in psychiatric wards. Effective policies must consider the multifaceted nature of these issues and provide comprehensive solutions that encompass housing, healthcare, and social support. Advocacy and awareness. Highlighting the lived experiences of these marginalized groups can combat stigma and foster societal empathy and support. Public awareness campaigns can challenge stereotypes and misconceptions, promoting a more nuanced understanding of the challenges faced by homeless individuals and psychiatric patients. Intervention strategies. Research can inform the development of targeted interventions that are more effective in addressing the specific needs of these populations. For instance, trauma-informed care approaches can be integrated into both homelessness services and psychiatric treatment to address the underlying trauma that many individuals in these groups have experienced. Health outcomes. Understanding the intersection of homelessness and mental health can lead to better health outcomes through integrated care approaches. This includes providing mental health services within homeless shelters and creating seamless transitions from psychiatric wards to stable housing environments. By addressing both the mental health and housing needs of individuals, we can break the cycle of homelessness and improve overall well-being. Case studies and empirical evidence. To illustrate the importance of this research, let's consider a few case studies. Case Study 1. The Housing First Approach. The Housing First approach, which prioritizes providing stable housing to homeless individuals without preconditions such as sobriety or treatment compliance, has shown significant success. Research has demonstrated that when individuals have a stable place to live, their mental health improves, and they are more likely to engage in treatment and other supportive services. This approach challenges the traditional model that requires individuals to address their mental health or substance abuse issues before receiving housing. Case Study 2. Peer support programs in psychiatric wards. Peer support programs, where individuals with lived experience of mental illness provide support to current patients, have been effective in psychiatric wards. These programs help reduce stigma, promote recovery, and provide valuable role models for patients. Empirical evidence suggests that peer support can improve patient outcomes, including reduced hospital readmissions and increased engagement in treatment. Case Study 3. Trauma-informed care. Implementing trauma-informed care in both homeless services and psychiatric wards acknowledges the high prevalence of trauma in these populations. Trauma-informed care involves understanding, recognizing, and responding to the effects of all types of trauma. It emphasizes physical, psychological, and emotional safety for both providers and survivors, and helps rebuild a sense of control and empowerment. Challenges and future directions. Despite the importance of studying these groups, researchers and policymakers face several challenges. Data collection. Homeless populations are often transient and difficult to track, making data collection challenging. Additionally, individuals in psychiatric wards may be unable or unwilling to participate in research due to their condition. Ethical considerations. Research involving vulnerable populations must be conducted with utmost care to avoid exploitation or harm. Ethical considerations include obtaining informed consent, ensuring confidentiality, and providing support to participants. Interdisciplinary approaches. Addressing the complex issues faced by homeless individuals and psychiatric patients requires interdisciplinary collaboration. Sociologists, psychologists, medical professionals, and social workers must work together to develop holistic solutions. Future research should focus on longitudinal studies that track individuals over time to understand the long-term effects of various interventions. Additionally, more research is needed on the impact of systemic factors, such as policy changes and economic factors on both homelessness and psychiatric care. This would include examining how economic downturns, changes in social safety nets, and healthcare reforms affect these vulnerable populations. The role of community-based approaches. Community-based approaches are essential in addressing the needs of homeless populations and psychiatric patients. These approaches involve local organizations, community leaders, and volunteers working together to provide support and resources. Examples include community mental health centers. These centers offer accessible mental health services, including counseling, therapy, and psychiatric care, to individuals in need. They often work in partnership with local shelters and housing programs to provide comprehensive support. Mobile outreach programs. Mobile teams of healthcare professionals, social workers, and volunteers can reach homeless individuals where they are, providing immediate assistance, medical care, and connections to longer-term services. Drop-in centers. These centers offer a safe space for homeless individuals to access basic necessities, such as food, showers, and clothing, as well as social services and referrals to mental health care. Supportive housing programs. These programs combine affordable housing with on-site support services, such as case management, mental health care, and substance abuse treatment, to help individuals maintain stable housing and improve their overall well-being. Conclusion: the sociology of homeless populations and psychiatric wards is a vital intersection of study that sheds light on the complex interplay between mental health, homelessness, and societal structures. By understanding these dynamics, researchers, policymakers, and practitioners can develop more effective interventions and policies to address the needs of these marginalized groups. Addressing homelessness and mental health requires a holistic approach that encompasses housing, healthcare, and social support. By integrating trauma-informed care, peer support, and community-based approaches, we can improve the quality of life for homeless individuals and psychiatric patients, ultimately fostering a more inclusive and compassionate society. The challenges are significant, but with continued research, collaboration, and commitment, we can make meaningful progress in addressing these critical issues.